And the more we talk about it on podcasts and just be candid about the fact that we're human and sex is part of the human condition.
Yes, sex is normal.
Yeah, sex is normal, and not having good sex is not normal.
Indeed.
When I was about 9 years old, my best friend Corey and I would ride our bikes every single day. That summer, we had made up a song that we would sing at the top of our lungs throughout all of Carolina Beach where I grew up. And it went a little something like this. We are the queens of masturbation. Dun, 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 dun. I am not sure where we had heard the word masturbation, but I can tell you right now, we had no idea what it meant. So fast forward, I pull into the driveway on my bike, singing that song, top of my lungs. My brother's outside playing basketball, and he's like, What did you just sing? And I sing the lyric to him, and he's like, oh, you can't sing that. And I was like, why not? And then he informed me what masturbation meant. And so I immediately ran upstairs, grabbed the phone, and called Corey. I was like, Corey, we can't sing that song anymore. That was the end of the queens of masturbation. Yeah, that's a real story. There are so many forms of sex, including masturbation. It's not simply the act of procreation, but it's also not the orgasm fest that porn led us to believe sex is. Sex means a lot of things to all kinds of people. So what even is sex? My name is Sarah King, and I have questions. And I know you do too when it comes to sex. We're here to talk about sex today, and I have Dr. Jenna Beckham with WakeMed OBGYN with me today. How are you?
I'm doing well. How are you?
So glad you're here.
Thanks for having me.
I got to say, we have the most questions for this episode. We consulted our listeners. We consulted colleagues, young and old. So, I mean, everyone, hopefully, if they want to, there are always the asexuals out there. Everybody has sex, and it's such a vulnerable thing to put yourself into. So it's hard to ask questions about it. What exactly, is there even a definition of sex at this point, given all the different combinations of people who could be possibly doing it?
That's a great point. I don't think so. I think really, there's so much that can be involved in sex and really in sort of intimacy, right? That can be physical, it's emotional. There are different parts of bodies that people use, different ways that people experience pleasure, right? I love that you mentioned that there are different, identities and ways that people partner themselves, and even asexual individuals who, for various reasons, are just not interested
into it, yeah,
and don't, participate in sort of our traditional definition of sex. So I would say, no, I don't think there's really a true, quote unquote, definition of what is sex.
I mean, are orgasms, are they considered mandatory for you to have sex?
Absolutely not.
Really?
Really, yeah. And it's really, I think a lot of us think, right, like that's the goal. You have to get to an orgasm. It's nice.
Yeah.
People love it when it happens, right? It's
a
great thing. But I don't think it has to happen. And I think there are people who can experience sex, with their partner, or a sexual experience even without a partner, and may not achieve orgasm. I think a lot of people were sort of taught, and they have this idea about it, probably some of it from popular culture.
Oh, yeah.
Perhaps even exposure to other
pornography,
right?
Yeah.
And they have this concept of what it needs to look like. But really, it's as long as that person is enjoying it, is getting pleasure out of it. Sometimes that's not part of it. Sometimes it's all physical. Yeah. And that's okay.
Yeah, totally. I looked this up, and there are 3 what I've heard as sexual dysfunctions. So let's just go down this list. First is arousal issues. So what is considered an arousal issue and what can cause it?
Yeah, so I think first of all, when we think about sexual dysfunction, really, a lot of these things used to be sort of hypoactive sexual desire disorder or function disorder. And they've sort of shifted away from that, I think, to give a little bit more space for what an individual's experience is.
Right.
And the other part of it is not only does it have to exist, but it actually has to cause that individual distress. Right. So again, as we kind of were talking about, every person's experience of sex is very different. So if whatever their experience is, they're comfortable with it. Like we mentioned, an asexual person who may not feel aroused by things, but that's okay for them, then it's not a disorder or dysfunction, right? It becomes a dysfunction when it causes distress to that individual.
Okay, like the word disease.
Exactly,
Which I don't think people think about that much, but it's just you're not feeling easy.
Yeah.
Okay, so I know that there are some medications out there that can suppress arousal. So what are some of these medications?
Yeah, probably one of the most common classes of medications are medications that are used to treat mental health disorders. So a lot of our antidepressants, some antipsychotics. Some of them are actually beneficial. Actually, really one of them, I should say, is...
Which one is that?
It's Wellbutrin, or the generic name is bupropion.
That'll get you randy,
Yeah,
eh?
yeah. It can be used on, it's off-label, but yeah, it's a good one if someone has depression, and especially if they start taking their antidepressant, right? It's a complex thing because depression in itself can contribute to sort of lack of arousal,
course,
right?
yeah.
Interest. But let's say they start their antidepressant, the depression is feeling better, but maybe their sexual desire is not improved or might even be worsened. Then you might think, is it the medication? Sometimes just switching it can help, but really a lot of them have that sort of side effect.
Yeah.
So that bupropion or Wellbutrin is a nice one that has good benefit for treatment of depression, but also has been shown to increase sexual desire.
So let's say you have one that's working well for your mental health. You're feeling better. Is there anything you can do to boost your libido?
Yeah, so there are 2 medications now that are FDA approved for premenopausal people. So, if you haven't gone through menopause, one of them the market name is called Addyi. So it's a pill that actually you take every single day, usually take it at night. It has some promising effects in terms of its positive effects on, sexual desire or arousal. But it has also a lot of sort of negative side effects.
Oh, like
sort
what?
of like makes your blood pressure low. It can cause like fainting spells.
Oh, dear.
You can't mix it with alcohol,
Well, then
certain medications.
Does sex even happen without alcohol?
Right. If you're like, you take it and you're like, oh, I feel sexy. And then I'm asleep, right? It's like, well, I don't know how well that
you
works.
wanted to do this.
Right? Yeah. So it's like plus minus. The other one is an injection. So it's actually a little shot that you give yourself underneath the skin. So that's one part of it. Well, you got to give yourself a shot.
Some people are into that.
Some people are fine. Some people are like, no, thank you. I'm
Yeah.
not into that.
Yeah.
But the benefit of it is it's not something you take every single day.
Yeah.
So it is, you use it like 30, 45 minutes
Situationally.
before sex. Yeah. So I guess it's the closest thing we have to like a Viagra.
And is that for men and for women?
Only for women.
Okay. So
Yeah.
Viagra is the go-to for guys.
Right.
Gotcha. It's about time they gave us our own little
That's right.
drug.
That's right. It's still not that good, I would say. They're working on it, but at least we have something now. But I think both of them are they have some downsides. It's not as easy as maybe, sort of what we think of for Viagra.
Well, and then also you mentioned it's for premenopausal women, which I could see why someone premenopausal would want to, because maybe they want to have babies. They want to be happy and have babies. Well, postmenopausal women also want to have sex. And is there any arousal issues that come with menopause?
Yes, there are. And it's a hard thing to truly understand. So we think, well, we know in menopause, estrogen goes down, right? That's sort of like the thing that is the most dramatic of menopause. It's associated with a lot of changes in our body, right? One thing that can be really commonly associated with sexual function, not necessarily directly sexual interest and arousal, but a lot of dryness.
Yeah.
And so sex can become more painful. So sometimes it's hard to parse out, is it the arousal gets decreased because, well, I know it hurts, so I'm not really interested in it, or is it just that pure arousal part? We also know that our androgen hormones, most commonly testosterone, but we have some other ones that are called like DHEA, those decline through after menopause, not quite as dramatically as estrogen. We don't really understand their role in sexual function. We look at, there's a condition called PCOS or polycystic ovarian syndrome. And a lot of people with that actually have really high levels of androgens. They've not been shown to have these sort of turbocharged sex drives, though.
Right.
So we're not like, oh, the testosterone
yeah.
isn't the thing that causes it. But there is some evidence that supplemental testosterone in postmenopausal people can help with sexual arousal.
Okay.
The hard part about it is in the United States, we don't have any real FDA approved sort of versions of it to give people.
I see. All right. Well, you mentioned painful sex, and that's the second on this list of 3 things that I found. So painful sex, how is that a dysfunction? I mean, it's pretty clear, but...
Right. Yeah. So there's different ways that sex can be painful. Sort of, we think about it kind of in 2 different ways, sort of insertional discomfort, right? You can't even sort of get started, or sometimes more pain with like deep insertion, right? There's different things we think about of what are the causes for that. And there's a variety of things. So not a fully inclusive list, but sort of things that can cause discomfort. I mean, sometimes history of trauma, right? Even though our bodies physically manifest a lot of things that, have sort of we carry in our souls and in our minds, right? So some of that's just a lot of tension, discomfort, any prior, history of that. There can be other conditions, things called like vulvodynia or vestibulitis, which are really, again, not fully well understood, but a lot of sort of hypersensitivity, discomfort kind of on the external parts of the vagina and the vulva.
Okay, and then the last on my list is difficulty achieving orgasm. And the first thing that comes to my mind when I ask you that as a sexual dysfunction is how much of it is mental?
Yeah, we think a lot of things, honestly, in all of these parts of sort of sexual dysfunction probably have a mental component. And that's the hard thing about treating it is there's not like, we don't have a pill you can pop and we say fix it, right? A lot of it can be sort of how you feel about yourself. We know that some, body image can impact it. As we already talked about, a little depression, sort of mood, fatigue, right? Something in the mood. But there are people who then, maybe they have great interest, arousal, or they can get into the mood with the right sort of, stimulus, but they just either it's very difficult to achieve orgasm or they cannot achieve orgasm. And it is thought that a lot of that is sort of more of a mental component. There are no physical or no pharmacological treatments for that so far. So a lot of that does involve sort of sex therapy, some directed stimulation, learning like masturbation, your own body, kind of figuring out what things work for you. And then if you're, engaged in sex with a partner, helping your partner sort of figure those things out.
Yeah, absolutely. You mentioned sex therapy. I kind of want to move on to that. When I think sex therapy, I think of, the lady who comes in and has sex with your husband and teaches him things, like I've seen a lot of TV shows with this. Yeah. Is that what sex therapy is?
Maybe there's somebody doing it like that. None of my patients have told me. I haven't referred them to anyone who's doing sex therapy that way. I think sort of, probably the American Association, I forget their full name, of sex therapists would probably not endorse that strategy. But sex therapists are often psychologists, sometimes clinical social workers who do some extra training sort of in the area, of sex therapy. And they can be relationship counselors in the same right. Again, we kind of mentioned some of this can be emotional. A lot of it can have to do with, sort of your relationship and finding time for one another, right? If you have distractions, right? We all know that can be a part of it. And also then sort of teaching some other, ways to find intimacy, thinking about things that can be cause arousal, engage, or not necessarily in the presence of the therapist, but sort of giving, couples or individuals sort of directed almost like exercises to do at home.
Okay. I want to circle back to orgasm for a second. What exactly happens during an orgasm physically?
Yeah. So an orgasm is kind of what we think of often as like the peak of the sexual function, so we have several phases of your sexual cycle. And in an orgasm, you can have a variety of things. A lot of times you'll have sort of, muscular contractions of the pelvic floor. The uterus actually contracts. So even like pregnant patients will sort of experience that in a way, right? When they have sex, it sort of feels like, oh, no, am I going into labor? And it's not funny. Labor, right?
My OBGYN told me at the end, because I was 2 weeks late.
Yeah.
And he's like, what got you in this could get you out of it,
right?
Because that contraction can start labor.
Yeah. So it causes sort of contractions. The clitoris often becomes engorged. We have a lot of, you have some increased lubrication leading up to that, some increased discharge. So it's a lot of just sort of physical changes in the pelvis and the reproductive
What about
tract.
in your brain? Things are happening
yes,
there.
Yes. Major hormone surges, right?
Yeah.
Lots of things. It's a pleasurable sensation, right?
Yeah.
You kind of go, and then there's that sort of post-orgasm period, right?
Yeah.
Which you always kind of see, and it's just like blissful.
Yeah, absolutely.
Like a little bit of a daze, kind of like, everything's wonderful, happy, great.
Yeah. Well, are there any health benefits to achieving orgasm? Because it certainly feels like it whenever the moment happens, but is there anything afterwards? Like if you haven't had an orgasm for like a year, is there something that your body could start to do? Do you understand what I'm asking?
Yeah. I think it's probably, I don't think there's any sort of evidence, sure, like that anyone who doesn't have an orgasm is worse off and those who do are better off. But yeah, it's a pleasurable thing. There's, those positive emotional hormones in the brain.
Yeah.
Right. It's kind of a short-lived thing, but I think it makes sense that if you're having those positive experiences, that it certainly is not harmful to you.
Yeah.
Right.
Okay. All right. I want to talk about HPV.
Oh, excellent.
talk about it. I
Yeah.
mean, it seems like it came out of the blue. It feels like for the consumer. I know doctors probably have heard about it a lot longer than we have, but this whole vaccine business, and I didn't even know about it until I was in my 30s.
Right. Well, and, in my age, your age, it wasn't really available, the vaccine, right? When we were younger, really, there wasn't as much knowledge about it. Now we know that HPV is the only virus that we know that truly causes cancer. Right?
That's
it's like
crazy.
a very clear connection. It's kind of wild, right?
So is there any other system in the body, or is it literally the only cancer we know that a virus causes?
There are
it?
some that have relation to it, but there's none that is such a direct cause as
Interesting.
HPV to cervical cancer, and therefore also that we have a vaccine for. So that's why I tell my patients, I'm like, this is actually really amazing.
It's
we have
huge.
essentially, I try to sort of advertise it in that way. This is a vaccine for cancer, right? Don't think about it as the vaccine for the virus. This is a vaccine for cancer, which is pretty impressive.
And how do you get HPV? Like, where does it come from? That kind of thing.
Yeah, HPV is a sexually transmitted virus. So this is another thing patients have a lot of sort of questions about. It is, right, transmitted sexually, but it's not the same as we think of other sexually transmitted infections in terms of like gonorrhea, chlamydia, that are acute situations that when you come in with symptoms of it or I diagnose a patient with it, I can say, yeah, this is from a recent sexual encounter. I don't know exactly which one, but I can tell you it's recent. Almost 95% of people who have ever been sexually active in their lives have been exposed to HPV.
And does it go away on its own?
It absolutely can.
Okay.
Yeah. So if it shows up, often we see it on a pap smear. That's the most common way. If it shows up on a pap smear, patients sometimes will say, did my partner cheat on me?
Right. That's
like
my next question.
I get that question all the time.
Yeah.
And I say, I don't know.
Yeah.
I can't say yes, I can't say no, but it's not, again, like something like, well, if you have chlamydia and you've only had one partner for 8 years, that came from somewhere.
Yes,
right?
yes. So you can get it from a benign place, is what you're saying?
Yeah. Yeah. And a lot of people were not symptomatic from it. It doesn't show up in the same way as other
Interesting.
sexually transmitted infections. So there's no way to know how long you've had it, where it originally came from. And it, like you said, it can go away. So it shows up sometimes on a pap smear, and then after a couple of years, it can go away.
Okay,
so it's
don't
a little
go
bit
divorcing
mysterious.
anybody because you've had this
No.
show up. Okay.
Definitely not.
Good to know. How effective is Plan B?
Oh, Plan B is very effective.
And are there any risks or side effects to it? This was a listener question.
Okay, yeah. So Plan B is considered is a type of emergency contraception. And there are actually two different types of emergency contraception. So there's classically Plan B, and then there's another one called Ella. They work a little bit differently in terms of how far after your sexual encounter you can take them. Plan B, you have a little shorter window. Ella, you have a little bit longer. As long as they're taken within that window, they're very effective. I guess they're very effective for most patients. They do have some weight limitations and are known to be less effective in patients who are higher weight or higher body mass index. They've studied and looked at, well, what if people take two of them or take, two different back to back? And they haven't really shown that that's necessarily been more effective at preventing a pregnancy.
Okay.
But overall, they're very effective and don't have any significant risk factors to use.
And you mentioned STDs a second ago. I mean, I haven't thought about them since high school. I've been married for quite a while. Are they still very prevalent in society?
They are. Yes, they are very
Your
prevalent.
face just said it all. If you're not seeing this on you, she just was like, oh, Lord, yes.
Yes, they are. They still exist. We still see a fair amount of gonorrhea and chlamydia. We've changed some of the antibiotics that we use for some of them because they have become so prevalent. We're seeing sort of resistance, meaning that the antibiotics we used to use are not as effective. There's a lot of ongoing studies looking at new antibiotics that might be more effective. And then we're actually seeing, here in Wake County, we have a particularly high rate of syphilis.
Oh, dear.
Which I think is not one that we kind of think about a lot.
I always think
as
of kings and queens and syphilis from like back in the day.
There's a lot of syphilis around.
Wow.
Yeah.
Wow, gross.
Yeah. Wear your condoms.
Yes, wear a condom. Oh my gosh. All right. So these are questions from listeners.
Okay.
And I'm just going to go down the list.
Go for it.
If you need to use lube every time you're with your partner, does that mean you're not interested in them?
Absolutely not. Your body makes some natural lubricant. Every person is different. Using lubricant is a wonderful thing. It doesn't signal that your body is not interested in your partner or that something is wrong with you. Certainly if you're having lots of discomfort, even with the lube, that can be abnormal. And I would say, you probably want to talk to your healthcare provider about it.
Yeah. When do you know? That's a great segue. When do you know? Because a little bit of pain perhaps might not mean anything. When do you know you need to go to the doctor?
Yeah. I think if it's always painful, absolutely. Even if, like I said, again, a lot of this is about what works for you, what feels good to you. Even if you're like, I'm just having a little bit of pain each time, but it's making it less enjoyable. I'm worried about it. I'm thinking about it, right? That can impact your sexual pleasure and your sexual function. So talk to your healthcare provider about it.
Okay.
I'd say we're not great about asking about it, unfortunately.
Oh, there's a lot of questions that aren't asked from your side to our side.
Right. So, I hope that a lot of us will ask our patients about it, but I know that we're not great about it. So, you have to feel comfortable, and I encourage, individuals and patients to not feel ashamed or embarrassed to bring it up and ask their providers.
Yeah, because you're an OBGYN, right?
Right.
And so, you deliver babies, and I wouldn't think to talk about sex to my OBGYN because I think your whole function is just pregnancy and delivery and whatnot. So it's very interesting that you are so well versed in sex, to be honest.
Yeah, we that's a very common thing. People think like OBGYNs, we deliver babies. We do. It's a big part of what we do, but we kind of deal with everything in the reproductive tract, and sex is a big part of that, right? It's a big part. Obviously, it's how we have babies a lot of ways, right? But it's also a huge part of our health and wellness. And it's something that's important for us as providers to address.
Good to know. Ask your OBGYN.
Yes.
Okay. This next question. My boyfriend swears he can feel my IUD when we do it. Is this even possible?
Feeling the IUD itself, yes, is possible. Although it's uncommon that they actually feel the IUD. The strings of an IUD do extend outside of the cervix. Usually they're a few centimeters, a pretty short distance. They'll sort of stick out straight when you first have the IUD inserted, but over time they soften and generally will curve around the side of the cervix.
Okay.
If your partner feels like they can feel it, certainly it'd be worth going in to see your provider just to do a quick exam to make sure the IUD itself isn't poking out. And sometimes the strings might need to be trimmed or adjusted in some way.
Could it hurt the guy?
Not like dangerous hurt. It can be uncomfortable, particularly if the IUD itself is like displaced, and if it were poking out of the cervix, that could be uncomfortable.
Yeah.
The strings can be when they're first put it, like when the IUD's first put in and they're a little more straight, but generally they're not painful. It's generally more that they're just kind of aware that they're there.
Gotcha. Okay, next. If I have sex with a man without using a condom, will it mess up my vaginal pH?
It can. Yes, vaginal pH is a really sort of, I think it's like, it can be sensitive to a lot of changes or, things that can disrupt it. Some people are very sensitive to any kind of change, like to the presence of sperm or ejaculate or something without a condom. But on the flip side, some people actually are very sensitive to condoms.
Yeah.
So I'd say it might alter it. It's not necessarily dangerous, and just sort of, be mindful, be aware of it. I would say do not douche. We generally recommend not doing
that used to be a thing.
It used to be a big thing. I think it's less common, but they still are sold, on Amazon and at the pharmacy. But those really do disrupt your vaginal pH. And
what happens when it gets disrupted?
Yeah, so we have a lot of normal bacteria in the vagina, and we want that to be there. That prevents infections, that keeps sort of just the environment not being irritated. It reduces things like yeast infections, other things like that. So douching sort of really cleans it out, but it cleans it out too well.
Right.
And takes away all that good bacteria. And so it can cause irritation. It could make sex more painful. It can increase your risk of things like yeast infections.
Right. So whenever you take too many antibiotics, your doctor always says eat yogurt. So how do you repopulate your vagina with bacteria?
Yep. Yeah. There's some people who believe in like yogurt, right? Eating it. Some people will take a probiotic pill. I have had patients who've told me they will, put those probiotic pills or even yogurt into their vagina.
I have friends who have done that as well, and I say good for you.
That's right. I would say I don't think it's harmful. I'm not sure there's any medical evidence that it's beneficial, but it's probably okay if it works for you. Then no harm, no foul.
Yeah. Wow. This the image. It's a thing.
Yeah.
Okay. Next up, can you have sex on your period?
Absolutely.
Okay. Is there any benefit to it at all? Or
So some people will think, well, if I'm on my period, then there's absolutely no way I can get pregnant. So there are people who will,
that's
right,
true.
who will have
Is that
sex.
true?
I always say yes with an asterisk. Yes, if you are 100% certain that you are definitely on your period, you cannot get pregnant. The trouble is people who have irregular cycles might be having some spotting. There's not a test that we can say, yeah, that's 100% your period. So I caution people about using that as a method of birth control, because there could be an instance where you're having bleeding, but
Like
it's
a
not spotting, right? And then you could still get pregnant.
Okay. Same line. Can you have sex on while you're having a yeast infection while you're using Monistat?
You can. It might not be very comfortable. Yeast infections often really cause the tissues in the vagina to be really inflamed, irritated. A lot of people have a lot of discomfort. If you're feeling okay, you're not having a lot of discomfort, and you're interested in it, it's totally fine.
Can you give the guy the yeast infection?
You can, but they're not as common on a penis as they are in the vagina.
Can a guy give a girl a yeast infection?
I think technically they could, although again, they're pretty uncommon, and they're not as much of like a transmittable infection. They come more from that change in the pH, the normal bacteria. So they don't think of them as much of sort of like a thing we pass back and forth.
Okay. Last question from a listener, and that is, this one's fun. My throat is sore after I go down on my girlfriend. Could going down on her be the cause?
Well, you can get sexually transmitted infections in the mouth and in the throat.
Oh, can you?
Mm-hmm. Yes, it is possible. I would say it's, probably if it's happening every single time only after you're engaging in oral sex and then it resolves on its own, it's probably not a sexually transmitted infection. But if you're noticing it's continuing, then definitely you should get that checked out. You can get chlamydia and gonorrhea, more likely gonorrhea, actually, of the mouth and the throat.
Oh, wow. Wow, that's also something that I didn't know could happen and sounds terrible. I think those are all my questions for now. I may have you back, though, because sex is a really deep topic.
It is. Yeah. We could talk about this for hours, I'm sure.
I can only imagine people are like, well, wait, you didn't cover this. So if you have any more questions, by all means, go to the link and we can definitely ask some more. I think what I'm, again, most interested in is the fact that, you're a doctor and sex has been happening forever and the medical profession's been around forever, but there's so much stuff we are still so unclear about.
Absolutely.
Is there anything you're excited about that's on the way of getting, fully understood?
I think I hope that we have more options for treatment for a lot of the things we talked about, some of the arousal, sexual desire. I think, Viagra has been around for a long time. It's certainly not perfect, but it's a great option for people with erectile dysfunction. And as I mentioned, we have some drugs available. They work, but they have some bad side effects, right?
Yeah.
I think that, not that everything in this country, right? A lot of times we want to be like, it should be fixed with a pill right away.
Right.
But I think we deserve a little bit more attention to our sexual function and pleasure.
Yes.
In general. And the pharmaceutical industry should pay us a little bit more attention.
You just made me think of something. I agree with that fully. You just made me think of something. Alcohol and marijuana.
Mm-hmm.
I know that there are marijuana gummies out there that are supposed to help with arousal. Have you heard anything about this?
Yeah, I have, and I think it's I'd say the thing with everything I think about sex is, it's so individual.
Yeah.
And there are things that work great for one person and terrible for the other. And so, cannabis, marijuana, there are some that can really increase, sexual pleasure, arousal, but some of them also can actually negatively impact it,
That's
right?
true, yeah.
So I think it just depends on the person. Same with alcohol sometimes, right? Just a little drink can help take the edge off, right? But then, if you have a little too many, or even some people are really sensitive and have one drink and they feel really tired and sleepy, right? So it depends on what works for you and your partner.
Yeah.
And a lot of it is just sort of, experimentation, open communication, I think is really important, right? It's a hard thing even for people who've been together for decades, right? This country, we're not very good at talking about sex. We're meant to believe it's sort of like a bad thing
like
we
a taboo.
do. It's a taboo, right?
Yeah.
So I think there are people who just kind of don't enjoy sex, but don't feel comfortable even talking about it to their partner. And so
Which
that's
is so sad.
It is really sad. It's really sad. So
Yeah.
I would say talk to your, OBGYN, but also if you're having sex with a partner, talk to your partner, right?
Yeah.
That's where it really is most important.
And the more we talk about it on podcasts and just be candid about the fact
Yeah.
that we're human and sex is part of the human condition.
Yes, sex is normal.
Yeah, sex is normal, and not having good sex is not normal.
Indeed.
All right. Well, thank you for your time today. It was so good to see you.
Sarah. You too.
I think the most important lesson in that conversation I just had with Dr. Beckham is advocacy. Advocate for yourself. Don't be embarrassed to ask your doctor anything. They have seen, heard, smelled it all. And when it comes to sex, it's part of life. Don't be so embarrassed. You're not crazy. What you're experiencing is not abnormal. Just ask the question and get some help. There's no shame in that. Sarah Has Questions is a production of Capital Broadcasting Company. My guest today was Dr. Jenna Beckham, a WakeMed OBGYN. To find out about her or any of the other providers from the WakeMed team, go to wakemed.org. If you have thoughts about any episode or questions you want me to ask in a future episode or ideas for an episode at all, send me a message in the link. You'll find it in the show notes. Thanks for listening.